Virginia Garcia was a 6-year-old migrant farm worker girl who cut her foot, and that wound became infected, and before she could get the care she needed, she ended up dying at the age of 6 years old, and her death really was the catalyst for the first Virginia Garcia clinic. Virginia Garcia really grew up because of advocacy, because of the original leaders and activists in the community who organized and came together. The clinic really moved from a very small operation to one that's providing comprehensive care throughout Washington and Yamhill counties.
The traditional health model that we carry in the medical field doesn't really meet the needs of a lot of our folks that we see in our enhanced care management team. The reality is a lot of folks are experiencing some significant social issues, such as lack of transportation, food insecurity, violence at home. There's so many things that can happen when a person leaves the office. Being able to have a full team that not only focuses on behavioral health needs, but also the social care navigator piece that can teach people how to navigate the system, I think is super, super rewarding.
The best thing in my job is to be able to communicate with people, to understand them, to be able to identify needs and to go and say, okay, you are going to get this specific resource, but let me teach you how to do it.
I'm really fortunate that I love the work that I do. I'm in school health because I believe in it. Our school-based health center provides medical and mental health services to students in the districts that we serve. So if someone comes in for a medical appointment but then expresses some behavioral health needs, we make sure that there is a very quick connection to our behavioral health provider. And the medical provider is generally the one facilitating that, offering a warm handoff. There's such a high value in supporting young people, and school-based health is a really good direct way to do that.
The motivation to provide more care to the population that we serve was important to me. I'm bicultural, I'm bilingual, so I know that the skills that I have benefit the patients that we see at Virginia Garcia the most. Virginia Garcia saw the need and the use for dental therapists in our clinics, so they agreed to have 2 of our hygienists, myself and another, go into this pilot program at Pacific University and have the extra training needed to become a dental therapist.
Our patients feel judged a lot of the time, so making sure that they get the care that they need is really important. Without judgment, I want them to feel safe, seen, and heard. And that's the care that I try to provide.
At the end of the day, it's the relationship between the patient and the provider and the care team. And Virginia Garcia takes those things into account. And we think that together we can really make a difference that is a generational impact in the community.